Back pain is the second most common reason patients see a doctor. 80% of people will have some form of back pain at some point in their life. And joining us this midday from Interventional Pain Management is Dr. Chad Austin. Welcome.
Welcome. Thank you so much.
Well, the first question, if so many people are having back pain, what is causing this back pain in all of us?
Well, it is so common, like you mentioned. Most of us are either affected directly ourselves or someone in our family has been affected by this. And like you said, it's so common. 80% of folks will have it. Second most common cause. And the good news is it's usually not caused by something serious like an infection, fracture, or cancer, and it usually does not require surgery. Okay. So like you asked, what is the most common cause then? The most common cause is going to be something called DDD, degenerative disc disease, or DJD, degenerative joint disease. A lot of patients may have received this diagnosis after seeing their primary care physician and they got an x-ray or an MRI and they're left with what does this really mean and what do we do about it? And it sounds so terrible, this disease that people have, but what it essentially is, it's wear and tear of the small joints in our back or the disc in our back. And there are a lot of things that can be done for it, like I said, not requiring surgery often.
Okay, so let's talk about what can be done. We don't want to get back surgery.
That's right.
So if we want to avoid that, what are some things we can do?
And well, we try to take a comprehensive approach at Alabama Pain Physicians, focusing on trying to get folks functioning and the quality of life. So the key initially is to get an accurate diagnosis. There are multiple things such as physical therapy. We may use bracing, sometimes a variety of different medicines, but also we do a lot of injections there, and many times an injection can provide significant relief when we target the exact spot where patients are having the problem.
And so how long does it take to work once you get that injection?
Again, it depends. There's a lot of factors that go into it, but some injections can work immediately. Some can take a couple of days and some even a couple of weeks to kick in and get their maximum benefit.
So ultimately, what can you advise us so we don't ever have to come see you?
Well, the key thing is continuing to, being proactive about it, maintaining core strength and staying mobile. And also, if you're having problems, don't delay it. There's no reason to suffer and let something get potentially chronic. The sooner you address it, find out what's going on, and do things early on to either mitigate it and then try to prevent it from coming back, you're going to be in a lot better spot.
So sometimes somebody like me, I have back pain, and we were talking about it during commercial break, that it becomes cause and effect. It's like my back hurts because I need to strengthen my core, but how do I strengthen my core? Because my back hurts, and you're saying you have a combination of techniques that could potentially help me get to that sweet spot.
And that kind of is like I said, the goal is quality of life and function and trying to prevent this recurrence. And a lot of times the injections allow us to facilitate physical therapy. If we're able to cool somebody down a little bit, and then they're able to get into therapy and then make that improvement and then kind of get on with their life, get back to work and do what they want to do.
Okay, I'm still looking for you guys to have the injection you can just shoot into the core and make the
and
core
just
the six
fix it,
pack. And sign me up for that injection. Thank you so much, Doctor.